OSS Health is a physician-owned orthopedic group performing joint replacement surgeries. They also treat osteoarthritis and offer surgery when treatment fails, one of those being the innovative Mako Robotic Assisted Joint Replacement surgery. OSS Health is sponsoring this segment this morning to share more about their treatment. Dr. Scott King joins me now. Thanks for being with us.
Thank you.
So what are the different things you can actually do to treat arthritis?
So osteoarthritis is essentially wearing away of the cartilage. And articular cartilage, just like on this blue area right here, that covers the bone in the knee. And so through wear and tear, sometimes injury, you get wearing away of that cartilage. And treatment usually begins with anti-inflammatory medications such as ibuprofen or Aleve, sometimes Tylenol. Physical therapy can help, bracing, and then injections, different types of injections we'll try. If all of those fail, the next treatment, and really the cure for arthritis, is knee replacement surgery.
So why don't you talk to us about knee replacement surgery? It sounds like a big thing, a big ordeal.
It is. It's a big surgery to go through, and it's a long recovery to go through usually, and it requires a lot of physical therapy and rehab. So what knee replacement surgery is we cut off the end of the cartilage here, and then we replace it with a metal and plastic implants. And that's done by cutting with a saw in that area. And after surgery, there is a period of recovery with physical therapy.
And it is a big decision. I mean, my father had that done, and actually he did quite well and recovered very quickly, and he's in his 80s. So it really is something that anyone could have. Now, you also have something called the Mako Robotic Joint Replacement. So talk to us about that.
So knee replacement surgery has obviously been around for many, many decades, and there's been small incremental improvements in knee replacement surgery. A few years ago, Mako Robotic Knee Replacement, robotic assisted knee replacement was really brought out to the public, and we started doing that. And that has been a significant innovation and really the biggest advancement that we were all looking for. And what that is we get a 3D CT scan of the knee, and we get a 3D model of the knee. Before surgery then, we know pretty much exactly the size, position, alignment, balancing of the knee, and it's all personalized to your knee. And then during surgery, we basically go and validate all of those preoperative measurements that we have. And so it improves. I've seen improvement in pain after surgery, speedier recovery, and overall outcomes have improved. One thing that, the biggest thing for knee replacement, or one of the biggest things, is alignment and balancing. And Mako Robotic Knee Replacement, within a half a degree and a half a millimeter, it aligns and balances that knee perfectly, which helps with longevity of the knee replacement as well.
Wow. So how do you know if you are a good candidate for something like this?
So patients will need to have moderate to severe arthritis in their knee. And for Mako Robotic Knee Replacement specifically, pretty much all patients that have arthritis are usually candidates for that type of knee replacement surgery. And I do get a lot of questions in the office about age. Generally, people think that knee replacement is, you have to be in your 60s or your 70s. And that's the goal. You don't want to do it at a young age, but there are some patients that have just really severe arthritis that limits their activities, limits their function and overall quality of life. So we do sometimes have to do knee replacements in patients in their 40s and 50s.
If people would like to find out more information or interested in possibly having this type of surgery done, who do they call? What is your contact information?
So we're OSS Health. We have offices in Mechanicsburg, Hanover, and York. And you can be seen at all three of those offices. We have our own OSS Orthopedic Hospital where we do just joint replacements and spine surgery. Our phone number is 717-848-4800, osshealth.com. And we do the most robotic assisted knee replacements in central Pennsylvania and probably at the very top in all of Pennsylvania. So we have very experienced surgeons doing this surgery.
Very fascinating, and I know it does definitely work. Thank you, Dr.
Yeah,
King.
thank you.
And as we head to break, we want to thank OSS Health for sponsoring this segment. We will be right back.